Public health. What is it? Well, in West Virginia, the way to answer the question, what is public health, is to define who is public health. And the answer to that question is, we are public health. We are people. The art and science dealing with protection and improvement of community health by organized community effort, and including preventive medicine and sanitary and social science. These segments were video recorded by Boone County Health Department Administrator and Nurse Practitioner Julie Miller, who asked the questions. Loretta Hattie is the West Virginia Bureau for Public Health's state epidemiologist and its director of the Division of Surveillance and Disease Control, holding each position for over 20 years. She says she has seen and is seeing it all.
And we've been able to increase our capability for the newest technology, the laboratory for identification of organisms so that we can determine what the source is on occasion in our outbreak investigations that we're doing. And then along came 9/11 and the whole infrastructure exploded again. So we've been able to build from medical disease control about 3-4 people. It's now a division of 6 programs and about 80 staff members. Health detective. And as the technologies have grown throughout the years, it's just been that much better to really uncover what type of diseases that are occurring in a community. And we now have the ability with the new technologies to do some DNA fingerprint type testing, just like CSI.
9/11 mentioned. Its aftermath has been a challenge for governmental units all over the country, and public health is no exception. Kim Lockwood is a sanitarian and epidemiologist with the Cabell-Huntington Health Department. She says the terrorist attacks of 2001 led to additional opportunities for service.
9/11 department, we developed a threat preparedness department and realized we were going to have an opening for a sanitarian to do disease investigations. A nurse who was doing the investigations, we had a regional epidemiologist who was doing these. So I joined them and started working and basically learning a lot because I'd never done it. And the regional epi we work together, and I really enjoy this much more than I ever did doing food inspections because people are actually usually glad to hear from you. They thank you a lot for your information, and I really feel like I'm making more of a difference than I was just doing food inspections, and I feel like I found my niche.
Public health, by its nature, responds to the circumstances of the society which it serves. And in a worst-case scenario, the public can be the giver of services, as well as the recipient. Cabell-Huntington Health Department Hall Dundas is also volunteer coordinator. She says involving the community's willing, helping hands is a key aspect of getting ready. She says it's one way things have evolved over 3 decades.
Public health just encompasses everything. I mean, we're involved in asbestos, we're involved in more water control. The volunteer program is a big plus. The threat preparedness, whoever thought we would have to worry about if our community was ready for a terrorist event. So the changes are ongoing. I think in 10 years the health department will be totally different from what it is now.
Virginia's rural nature, with its often sparse population, calls for a flexible skill set. Grant County's nursing director, Sandy Glasscock, knows from experience her job is really many jobs rolled into one.
I'm the nurse director, the FinPAD trained breast and cervical provider, the threat preparedness coordinator, the SNS coordinator, the risk communication coordinator, and several others. I won't go on, but that's just to show in small health departments we have to wear many hats because we don't have a lot of staff. Every day I get to work and say, who am I and why am I here? And once I figure that out, then we get to work.
And the work of a health department nurse is quite a contrast to what's found elsewhere. Karen McLean is the administrator and nursing director for the Brooke County Health Department. Part of her background is in sharp contrast to what she's doing now.
I was in the private sector doing clinical practiced for 28 years and have been with public health for 7 years. And what I noticed with public health, which makes it unique and different from any other type of health care, is that it is population-based and with its main goal with prevention instead of intervention. Okay. So that can, really make it so that you have to really stretch because you're taking care of your whole community as opposed to just one person at a time.
Department Administrator Linda Klotzbach says this type of employment's been good for her.
I began at the health department 22 years ago as a clerk in the front office. Then I became the office manager, and then 4 years ago I became the administrator. I like working in government. There's a lot of opportunities to help the people and to get really involved in the community. And I feel very fortunate because I moved through my career, make a lot of success, and I consider myself a very fortunate person to have become involved with public health.
As you can tell, there are lots of ways to contribute to the good of an agency. Lisa Holstein is an office assistant with the Boone County Health Department and says her time in various duties has taught her how valuable these services are.
Currently, I'm a billing clerk, a volunteer coordinator, and a training coordinator. I feel like my job is very important because I believe in public health.
Public health is quite an inclusive enterprise when it comes to skills and schooling. Cabell Huntington Health Department accountant Nancy Hall says her contributions are valuable to the overall operation, which is true for many others in office positions. Linda Whaley is a food program manager for the State Office of Environmental Health Services. She says her schooling is useful, even though it's non-traditional for her position.
My education, I graduated from Concord College with a 4-year degree in social work, which doesn't really pertain to the work of sanitarian, except the fact that as being a sanitarian, you really have to be able to talk to people, understand where people are coming from, and know what is making them tick and where their interests and concerns are, and really getting them to open up to me as a sanitarian to learn how to better answer their questions and help them with the problems that they have.
Nursing Director Jennifer Wall says each day is a challenge.
Public health is not just what you do at your local health department. It's not just about clinical services, but it's also about deciding what public health is around the state. And all health departments need to have some input on that. Since in West Virginia, public health is decided, there's a state level public health, but they need input from the local communities to decide what needs to be done on a local level for the individuals. Because only the community can decide, what is a health issue in their area.
An interesting aspect of public health is that it's as local as your own neighborhood. Yet it's also regional, national, and even global. Sam Crosby Jr. is the Centers for Disease Control and Prevention Public Health Advisor assigned to the West Virginia Bureau for Public Health Immunization Program. He brought a wide-ranging background to the Mountain State.
I was a health enthusiast major in college, but in the Army I was a medic. I had the experience of the swine flu outbreak in 1976 when I was in the Army at Fort Dix, New Jersey. And spent 5 years in New York doing the STD. I'm here for a 2-year assignment. It's been 18 years.
West Virginia Public Health is fortunate to have veterans of decades past, to offer vast expertise to our citizens, both today and tomorrow. Stan Mills is the Cabell Huntington Department's Threat Preparedness Coordinator and Project Manager. He says all of his experience is really for the benefit of those to come. So there you have it, the story of public health in West Virginia, from the people who make it happen. It's a story told from many angles, about programs that impact almost every resident of the state in one way or another. It's a story with a common thread, from past to present to future. It's a story of service, which is provided to West Virginians every day. We hope you know us a little better than before, and we're glad to be part of your community. We are Public Health.